Hello friends, this is Dr. Vikas Singhal, and today we are going to discuss a very important topic that is gastro-esophageal reflux disease. More commonly this is called as reflux disorder, and very commonly used abbreviation for this disease is GERD, gastro-esophageal reflux disease. GERD basically it is a condition in which the stomach content, just because of one or the other causes with esophagus and food pipe, the stomach content refluxes inside the esophageal cavity, and as the content of the stomach are mostly acidic in nature, this corrodes the lining of food pipe, and this creates heartburn. This creates inside burning felt at the epigastric region, at the sternal region, and so on. So my friends, coming to the various causes or trigger factor I should say regarding GERD, gastroesophageal reflux disease. My friends, most common reason, as I have already discussed, this is just neuromuscular incoordination of the muscles of lower esophageal sphincter. What I mean to say is कि जो हमारा फूड पाइप है, फूड पाइप के नीचे की जो ट्यूब जो कि स्टमक को कनेक्ट करती है, वहाँ का जो स्फिंक्टर है, वहाँ की जो मसल्स हैं, उसका जो पार्ट है, उसमें अगर कोई न्यूरोमस्कुलर इनकोऑर्डिनेशन रहेगा तो समटाइम्स जो कंटेंट है, स्टमक कंटेंट, वो इसोफेगस में चला जाता है और पेशेंट को जलन का अनुभव होता है. पेशेंट ऐसा महसूस करता है कि यहाँ पे डॉक्टर साहब, यहाँ पे ना कलेजे पे बहुत जलन होती है जी. तो माय फ्रेंड्स, कमिंग टू नेक्स्ट रीजन फॉर दिस, हाइटस हर्निया समटाइम्स मे बी डिटेक्टेड. And now coming to the different trigger factors, sometimes after smoking alcohol, after taking too much stress, and consuming heavy diet, especially the so-called junk food, this may create a normal phenomena in this gastric mucosa, and all the gastric as well as esophageal mucosa are corroded just because of the acidic content of the stomach. And my friends, just because of that, patient feels the symptom of burning. And now coming to various other trigger factors, sometimes drugs used as medicines, especially of hypertension, as well as especially medicines, some medicines for diabetes like metformin and glycomet and other medicines of diabetes mellitus. This may cause burning in the stomach. GERD symptoms may prevail after consuming that. And some medicines prescribed for depression and other psychiatrical issues, multiple sclerosis, Parkinson's, some drugs may also cause GERD symptoms. So my friends, except this, there may be pregnancy. During pregnancy, this phenomena is very common, just because of lower area space gets lower, gets decreased, just because the abdominal cavity is occupied by the fetus itself. And some other reasons may be some dietary changes, and as I have described, stress is a very major factor. Stress is a very major factor. Just because of stress, there may be neuromuscular incoordination of the lower esophageal sphincter, and this problem may arise. Now coming to the symptoms, as I have described, burning in the stomach and mild pain in the stomach with nauseated feeling. Sometimes patient gets nausea very easily. Patient will come and say that doctor, I am not feeling well, especially when the sight of smell sometimes and cooking of the food, this aggravates my nausea. So nausea, vomiting sensation and all these things, this indicates if it is prolonged more than 3 weeks or 4 weeks, you should consult your medical doctor. And my friends, coming to the differential diagnosis of this problem should be well differentially diagnosed with herniated, especially the hiatus hernia. and achalasia cardia I have already described, and some other diagnosis also. And now coming to the treatment, in homeopathy we are having number of medicines like Cinchona officinalis, Colchicum autumnal, Bryonia alba, Arsenic album, and various gastric medicines like Ipecac and Nux vomica, Nux moscata, Asafoetida, Crocus sativus. These are one of the wonderful medicines for GERD, and no doubt we consider the totality of the symptoms of the patient and never prescribe on one or the other symptom, because it is the patient who is ill, not his sphincter, not his stomach, or not his heartburn. We have to cure. We have to cure the complete patient. We have to cure the whole organism. So in homeopathy we are having very valuable and excellent treatment, and in our day-to-day practice, just because of side effects of allopathic medicines, most of the time antacids are being prescribed for this, and of course constipation is one of the reason for this, and just because of constipation patients are taking purgatives and some other type of Kayam Churan and everything related with constipation. This will lead to one or the other form of GERD, gastro-esophageal reflux disease. So my friends, this was in very short summary about GERD, and in any case, in any condition, you can contact our clinic for your problem, or if you are too far away, then you can consult your qualified classical homeopathic physician nearby. Thank you very much.